Hello, my name is Kenneth Gordon. I'm a dermatologist at Northwestern, and I'll be discussing two papers that were recently published in the Journal of the American Academy of Dermatology concerning psoriasis patients and hospitalization. When we think about the overall health of psoriasis patients, we oftentimes think about outpatient care, the severity of disease, and even comorbid disease like cardiovascular disease, renal disease, or depression. We rarely start thinking about the impact of this disease on things like hospitalization and infection risk in hospitalization. Why that's important is because these patients do get hospitalized, and if there's a significant difference in the patients who have significant disease, then we might have to think about treating patients a little more aggressively for their psoriasis. Moreover, understanding the populations who might have issues associated with hospitalization and psoriasis is, I think, critical because it really looks into the impact of access to care and how patients are cared for in looking at whether this has greater implication for their health. These two papers were papers that derive data from the National Inpatient Survey. This is a survey of over 87 million hospitalizations. And they looked at both psoriasis primary diagnoses, that is the primary reason for admission was psoriasis, and where psoriasis was listed as a secondary diagnosis. Most importantly, in looking at these data that were published in these papers, the thing that comes to mind is the rate of hospitalization in patients and the demographics of those hospitalizations. As one would expect, patients who are older tend to get hospitalized more frequently. But it's an evaluation of the other demographic characteristics that I think something really important is demonstrated. Patients from what we normally consider to be underserved minority groups, patients who are Black or Hispanic, tend to have a higher rate of hospitalization for psoriasis than patients who are white. And that is despite evidence that psoriasis is more common in white populations. Additionally, patients who have lower incomes and have insurance that is not third-party commercial insurance, but things like Medicaid, who are non-insured or have Medicare, also tend to be hospitalized more frequently for psoriasis. While there are multiple explanations that this could come from, I think it's pretty suggestive that patients who have less access to dermatologic care and high-level medications for psoriasis are more likely to be hospitalized for psoriasis. Moreover, there's a cost to that, and the hospitalization costs are not only high for the initial hospitalization for psoriasis, but patients with psoriasis who are hospitalized tend to have longer hospitalizations than patients without psoriasis. All this suggests that the cost of hospitalization, potentially made worse by patients who do not have proper access to care, actually adds to our overall healthcare costs by quite significant amounts. Then another paper looks at the potential for infection in patients who are hospitalized with psoriasis. And what this paper suggests, to summarize quite quickly, is that patients with psoriasis who are hospitalized tend to have a higher rate of severe infections than do patients without psoriasis. Interestingly, one of the infections that stands out in this study is cellulitis, a disease, infection of the skin. But even other infections are also increased in patients with psoriasis. When taken as a group, I think these patients really demonstrate the severity of the impact of psoriasis on the overall health of patients. This can lead to hospitalization and severe infection, and really makes us think about how we can distribute our therapy and medication to cover all groups of psoriasis to improve the health of the general population.